Thank you. Can everybody hear me? Is that okay? Yes. I feel a bit strange, I have to say. I am a dentist. I am used to presenting to dental audiences and dental practice teams, so very different world for me today. However, I was very pleased this morning to be listened to so much about prevention, which is something, obviously, as dentists that we are really passionate about. I am a principal in a practice that I own with my husband in Thatcham, West Berkshire, but I have been sucked into the world of Denplan 4 days a week. The majority of my work is supporting practices and practice teams, but I do help our corporate team quite a lot in the aspect of claims, assessing claims, but also just on general advice and guidance. So what they asked me to do today here was really to look at dentistry and dental benefits can quite often be seen as just a very small, tiny benefit compared to some of the biggies like PMI and so on. But actually, there's a bigger message behind it. So the mouth is the window to the body, for sure. I know I'm biased on that, but I think that's a well-known saying, and it is true. We see a lot as dentists, and one thing that we are very privileged in is the fact that we see, for those patients who come to see us, we see them quite regularly. We see them more regularly than their GP would see them. We see them potentially more regularly than the gym sees them. So we do have that relationship with them. Denplan can conduct every year a consumer oral health survey looking at the patients rather than the dentists that we work with. And what is rated as important, and this comes up every year almost the same, to patients who visit regularly, which is classed as once every 2 years. Personally, as a dentist, I think it should be a little bit more than that, but that's how they look at it because that fits with the NICE guidelines. But the number one every time that comes up is trust. That's what they do, and therefore we have this very special relationship with them. So we are not just looking at teeth, and the nice awareness of that is the fact that the patients that we treat and the whole population, and listening to what was being discussed this morning, is so valid that people are starting to realise that poor oral health can have a significant impact on your overall health. And the research and the figures that are coming out of this are just getting more and more conclusive, especially gum disease, huge issue. And of course, that is a big part of what we do and a big part of our practice. So people are starting to become aware. And also, big chunk, again, 3/4 of adults agree that signs of serious disease and illness can be detected in their mouth by their dentist. So there is an awareness that we can do this. We're not just there to gum garden, as we call it sometimes, and restore broken teeth. That's not what we're about. We are about the whole body. So what are the biggies? What are the big things that the research is starting to show that there is significant links between? First one is heart disease. I'm sure you'll all know that. Big link between gum disease, between periodontal disease and heart disease. And the evidence, as I say, for that is growing every piece of research that's done. Strokes is another one that comes up again significantly, but the big chunk that we're very aware of, and massive increase in the population, is diabetes. So especially type 2 diabetes. We all know it's a growing problem. The cost of it to healthcare is huge. The cost of it, if it is covered under PMI, is massive. But one of the things that they feel that is causing potentially or adding to the complications that diabetics are getting is the inflammatory cells that are kicked off in gum disease actually trigger and alter the difficulty of sugar balance, and that's potentially why they're getting further problems. So if they are well controlled, if their diabetes is if their periodontal disease, if their gum disease is well controlled, there are lots of studies now starting to say that their diabetes will be better controlled too. So it's a really massive healthcare message, and we as dentists have been seeing that for a long time, but the message is finally starting to get out there. Another one that people aren't always so aware of, but I think especially for employers, if you're sort of thinking, well, heart disease and strokes, that's in the older aspect of my population as an employer, but actually giving birth to a premature low weight baby, obviously very significant in a very different age of the workforce. So they again have proven now that if you have increased gum problems whilst you are pregnant, you are more likely to have a prem baby, and of course all the associated costs that go with that. Now, I know in this country, of course, a lot of that is picked up by the NHS from a cost perspective of treatment, and wouldn't necessarily come into their PMI. But from an employer's perspective, and I can speak from experience here, but I can say she doesn't have gum disease, is my hygienist gave birth to her baby daughter at 31 weeks. So that was a little bit of a shock, considering we thought she was going to be treating patients till 38 weeks. So in a small business, 7-week time period when my hygienist is suddenly not there. So massive significance. So as I say, I know she hasn't got gum disease, but that impact on a business can be huge. All the planning that goes on is just falls foul, and that is a definitely increasing trend. Lung disease is another one, and of course lung disease as well. A lot of the problems we see with periodontal disease, there is a massive link between smoking and periodontal disease. So it's not surprising that lung disease starts to come into this now, because you've got the same risk factors going on for patients. So how does this all relate of why should somebody actually have a dental plan? The big thing, I think, is the prevention that we do, preventing people from getting to the situation where they have got uncontrolled periodontal disease. But also then, what do we do that we look at other than that we are picking up, as I say, signs of other disease processes early? So we are looking for oral cancer. That's an obvious one. I think you'd all expect us to be looking at that. And we have got an increasing a tendency of oral cancer in this country. We're not quite sure why it's rising so fast, but it is. And like any cancer, if it is picked up early, then it can be treated. But obviously, the later it's picked up within the mouth, and if people aren't coming regularly, it just isn't going to be seen. Because it doesn't take it to get very big before it starts to become very, very significant. So if that person is not being checked regularly, then that just won't be seen. And by the time it is seen, it's too far down the line. And that is not just happening in the older population. We are seeing it in much younger adults as well, 16, 17-year-olds, early 20-year-olds. It isn't a disease. I think people associate it with increased smoking, increased drinking, which it is, and they are significant risk factors. But it is also, we are seeing it in the lower end of the population, very tough thing to have to deal with. We also see a lot of signs of blood disorders, and we quite often see them early, before they've even seen anybody else about it at all. We are trained to look for it, we notice the differences, we pick up problems, and we can often be the one sending them off to the GP to say, do you know what, you need to go and get your bloods checked, there's something going on here. That's the same quite often with some of the leukemias and so on. Again, they manifest themselves in the mouth quite early on, and if they're picked up, if patients going regularly, being seen regularly, they can be picked up much earlier. So again, from an employer's perspective, anything that's picked up earlier is going to be much easier to deal with and treat, and less time off. GI problems, again, is biggie. Crohn's disease, again, is very, very often picked up first in the mouth. Oral ulceration, there are certain different types of ulcer that you get that we see. So we are seeing those again when somebody maybe is having symptoms, maybe not performing at their best, but actually haven't thought, you know what, I really need to go and see the GP. This is a bit embarrassing. I'm not necessarily wanting to talk about it, but we will pick those up and we ask those questions. Skin lesions as well. We do look at the whole body. We are very much taught to look at our patients as they walk in through the door, not just as they sit down in a chair and we look at their mouths. We very much look at them, and because we see them regularly, again, we see those little changes. We see a change of somebody not walking very well, or we see a change in the fact of their emotional state. And we are very, very privileged because of that trust issue. We get told all sorts, absolutely all sorts, to the point that we sometimes don't do dentistry. I remember having a lady years ago who came in, obviously very stressed, and I said, not great, and obviously people don't like particularly seeing us anyway, so we're quite used to dealing with people who are, but this was a patient who normally is quite relaxed. And she said, well, I'm here, but she said, I've just had a bit of a strange thing. And I said, well, what's happened? She said, well, I popped into home on my way home, and I found my husband's wedding ring on the table and a note to say I'm leaving. So I said, so why are you here? And she said, well, because I didn't want to break my appointment and let you down. So needless to say, we did no dentistry. We sat and talked, and I was the first person that she had talked to, and she had that confidence because she'd seen me all of those years before to sit down and have that conversation, and I could then guide her to where she ought to go to for support. So we don't just do dentistry. I know that's a bit of an extreme example, but we do that all the time. Eating disorders is another one. We see signs of this very early on, again, because of the damage, especially with repeat vomiting, we see the damage on the teeth. So again, I've had this. I had a father once who said to me, I've been treating the whole family for a long time. Daughter was about 17, 18 by this stage. And he said, please, will you talk to her? We as parents are almost certain that she has bulimia. We cannot get her to talk. We've tried to approach school, but it's all very sensitive and we're being very careful. Can you please make sure you really, really look to see if there's any sign on her teeth? And then please, will you talk to her? There was the snippetest bit of change, but it did give me the opportunity to talk to her, and she was referred to the GP, and she, within a couple of years, was pretty much sorted out. So again, we are looking for really big things that can affect somebody, and because of that relationship that we have with them, we just learn so much. So there is masses. We don't just do teeth, and that's what I'm trying to say to you, and it is about prevention, massively about prevention. All of these things picked up early are better treated. The other side of that, though, is about the amount of time that people take off work for dental problems. This was some research done in 2012. 415,000 employees took time off. This is in England due to a dental problem. But this is what freaked me out a little bit. And obviously all of you will have seen in the news recently the increase in GA for extractions for children, that 1.1 million people took time off work to look after their child. So over double the number of people who took time off work for a dental problem was actually for their child. And this is a preventable disease. So in this whole wellness and well-being that you're talking about here today, it's interesting that you're talking very, very much about employees and how to look after them, but actually how does that impact onto their whole family? That's huge. If you can have that impact as employers onto your employees and be teaching the next generation down, that's fantastic. Because as I say, for dentistry, most of what we do is completely preventable, does not need to be there at all. And as I say, it's the stats at the moment with GAs, I've been in the situation of, I used to do it years and years ago when I first qualified, or a year or so after I first qualified, worked as a senior health officer in Newcastle Dental Hospital, and Friday afternoon I had to do the GA session for kids. I used to dread it all week, and it was the most horrible thing. Seeing little 2-3-year-olds who've only just got all their baby teeth through and having to remove all 20 of them. It's absolutely just the worst thing you do professionally, and it is all preventable. So it is a massive oral health and general health message as well, because of course those children, how much sugar are they eating? What are the long-term effects of that sugar? We're talking here as well. Sugar is a big thing on the agenda at the moment, but mainly related to obesity. It seems to be, or us as dentists are a little bit frustrated that there's so much focus on obesity, but actually dental health, when this is the biggest figure for GAs for children in this country. So that's just a bit of an overview. I'm keeping it very short and sweet because it is, I could bombard you with all sorts, but it is about how it impacts. This figure, I think, to me as a dentist, if you say, why is it so much higher amongst men than women? I would say that's because men don't go as much and they don't go as regularly. They are a little bit baby about it. Sorry to the men in the audience, but they are. Women are much better at attending regularly, and they attend regularly a lot of the time because they've got children that they want to create good habits for as well, so they will attend regularly. They do drag their husbands along sometimes, but it's men on their own, generating their own appointments, we know well in dentistry is not so great. So of course, no wonder their absence is higher, because they are the ones that are then getting problems and getting pain. And as I say, it's all preventable. If they were going regularly, they wouldn't necessarily be in that situation. So again, that's a big, big message. This I found really interesting, that the average absence length in days of somebody, if they do take, now this is not the incidence, this is that if they do take time off for dental problems, 2.37 days they will take off if it's a dental oral health problem. And if you look at that compared to diarrhea and vomiting and headache and migraine, now, okay, those are going to be occurring more often, obviously. But that was really interesting to me, that actually if people were taking time off work for dental problems, they were taking longer off work. And again, the majority of the time, absolutely preventable. So I think that's it, really. It's, as I say, a bit of a whistle stop. It is National Smile Month this month. And just for a little tip, remember that 2/3 of people have less respect for a boss who has bad oral health. So that's it. If you want to ask any questions, you're very, very welcome to. Either if it's more about our plans, I do know a fair amount about it, but Colin is probably better to answer. But if it's a general dental oral health, then please ask me. Okay. Silence. Sorry, thrown you all. No? Lovely. Thank you very much.
Thank you.